This case contains UBGEN biomaterials, proposed in different formats, which we are illustrating in the following video. First of all, take the vial supplied with rebone bovine xenograft. In this case, it is a cortico-spongious bone in microgranulars of 0.25 to 1 millimeter. Pour the product into a Petri dish. And rehydrate it using a syringe pre-filled with sterile saline solution. It is preferable to use rebone with the patient's whole blood or with autologous blood components to enhance angiogenic and bioreparative processes. Take a spatula and mix. It can be noticed how the microgranulars do not separate from each other, but begin to amalgamate with the physiological, creating a bone paste, the so-called sticky bone. Let's see an example with the patient's blood. Let's examine our syringe containing rebone granules, free of carriers that could interfere with the healing process, designed with a small diameter and angled to be easily used even in posterior positions. Unscrew the syringe cap. Soak the content of the syringe by withdrawing physiological solution through the filter until the level of the liquid barely exceeds the level of the granules. Wait about 5 to 6 minutes to facilitate the absorption of the liquid. As already mentioned, it is preferable to amalgamate rebone with autologous blood or blood components to enhance angiogenic and bioreparative processes. Expel the excess fluid by slightly pushing the plunger of the syringe 2 to 3 times. Remove the filter from the tip of the syringe. To do this, simply screw the cap back on, connecting its threaded inner side to the syringe. These operations serve to maintain the sterility of rebone. The biomaterial is now ready for use, and we can apply it directly into the bone defect using the syringe itself. It is advisable not to compact the granules, but to maintain the space between them in order to promote angiogenesis and allow bone colonization. Let's see an example with the patient's blood. Finally, let's move on to the shelter membranes. In bovine pericardium, which UBGEN offers in the fast version, with resorption already starting from the 4th week, and in the slow version, cross-linked membrane with slow resorption with a barrier effect of 4 to 6 months. Both versions are available in 3 thicknesses, 0.2 to 0.4 and 0.8 millimeters, to be used depending on the biotype of the patient or the type of intervention. Take a membrane and place it in the Petri dish. Then bathe it with sterile physiological solution. And with the help of forceps, handle it. It can be immediately noticed that it rehydrates quickly. It does not stick on the instruments or on the surgical glove. A peculiarity of shelter is that it has no front or back side and adheres easily forming a seal on the intervention site. Finally, perform an elasticity test by stretching the membrane. It can be verified that it is highly elastic and does not tear. It can also be pierced without causing tears, for example, when fixed by pin. Shelter has a high chemotactic capacity. Therefore, in case of exposure, it promotes the repithelialization of soft tissues in a short time. We illustrated the peculiarities and advantages that distinguish UBGEN biomaterials. For more information or to receive scientific advice on our products and possible applications, contact us at info@ubgen.com or visit our website www.ubgen.com.